Thank you very much, Mr. Chairman. And Mr. Chairman, I want to thank you because this is an exceptionally important issue, and I think we do need to have our committee tackle it in a bipartisan way. And I also want to thank you for moving this morning's start time to 9 a.m. because we both know there are members that want to attend the memorial service to Chairman Cummings. Today's hearing is going to spotlight the pitfalls Americans face when they try to find quality treatment for a substance use disorder. An American battling this disease is often jostled and pushed around from one end of the healthcare system to the other. The last thing you need when you're suffering from this disease is yet more obstacles, rip-off artists, empty promises, or just out-and-out abuse. The last thing you need is that when all you want to do is get better. Too often people travel across the country expecting to arrive at a legitimate treatment facility only to find that they've fallen prey to a scheme, the goal of which is to drain their bank account and just milk their insurance for everything it's worth. In some instances, unscrupulous operators are working to lure patients by paying for plane tickets and promising free rent. Once the patients arrive, what they end up getting is lousy care or no care at all. And then the fraudsters just go out and bill the insurance companies for health care services that may never have even been performed. One of the biggest problems involves facilities that allegedly treat substance abuse disorders but are actually set up to rip off taxpayers. The fraudsters illegally recruit patients using bribes and kickbacks, and then they bilk the taxpayer by billing the patient's health plan for medically unnecessary drug tests. Schemes like this, and we're very pleased to have this really terrific group of witnesses today, they're going to outline these schemes in detail. And of course, these schemes as well cost Medicare, Medicaid, and private insurance hundreds of millions of dollars every year. Just this month, 6 people operating a network of fraudulent treatment centers in Ohio pled guilty to submitting 130,000 Medicaid claims that totaled more than $48 million for medically assisted treatment and other services that were never legitimately provided. Part of the reason this type of fraud is so common is because there's no way for a patient or their family to learn about the quality of a treatment facility before they enroll. So today we're going to hear from an organization that is saying, hey, wake up everybody, this has got to change. Shatterproof is currently developing public databases in multiple states that, if successful, will allow the public to identify, evaluate, and compare substance use treatment programs. This kind of database and transparency is the type of information that American families deserve to have, and they deserve to have it now, because it'll be a key tool to find quality treatment and avoid sham operators trying to make a quick buck. One other point that occurred to me as we were preparing for this hearing is it's particularly important now to set in place the kind of concrete policies to rip off, to make sure that these programs are not ripped off and the patients are not taken advantage of, because when you read the morning newspaper, the fact is that states and communities may now be on the cusp of receiving tens of billions of dollars from the companies that helped seed the epidemic. And I can just look down the road because I've heard about this from virtually all of my colleagues. So if you're talking about a fund of tens of billions of dollars, a sum of that size is going to be a magnet for the fraudsters and the rip-off artists. So this hearing is going to highlight the need to make sure that there are the rules of the road and vigorous oversight so that those dollars actually go to help patients get proper care, and all that new money doesn't just find its way into the rip-off artists. I thank the witnesses, and Mr. Chairman, again, your leadership. We're going to work on this in a bipartisan way, and I look forward to hearing from the witnesses and our colleagues.